Your doctor just called, the results are in, and 3 little letters have turned your world upside down. ANA positive. You're suddenly hit with a wave of questions. What does this even mean? Do I have an autoimmune disease? Am I okay? Take a deep breath. You've come to the right place. Stick with me and we're gonna break down the 5 most important things you need to know about a positive ANA. And number 5 is a twist you probably won't see coming. Hey everyone, if you're new here, I'm Dr. K. I'm a board certified internist and gastroenterologist, which is a really fancy way of saying I'm obsessed with helping you understand your health. Here, we don't chase health trends. We ask the tough questions and find the real answers. So let's decipher that positive ANA by starting with number 1. Number 1, ANA is a blood test to detect autoimmune diseases. Okay, let's get this straight. ANA stands for anti-nuclear antibody. Think of your immune system like your body's highly trained security team. Its job is to spot and identify foreign invaders like bacteria or viruses. But sometimes the security team gets confused. In an autoimmune disease, the security team mistakes your own healthy cells for a threat. An ANA is a specific type of confused security guard, an antibody that targets the very center of your own cell, the nucleus. The nucleus is a cell's command center where your DNA is stored. When these antibodies are present, it can be a red flag for an autoimmune condition like lupus, rheumatoid arthritis, or even autoimmune hepatitis. It's a sign that your body's defense system might be on the attack. Which brings me to a crucial point. Number 2, not all positives are created equal. Your ANA result isn't just a simple yes or no. It comes with numbers, and these numbers are everything. You'll likely see something called a titer. Let me show you what I mean. Think of this blue food coloring as the ANA protein in your blood. The lab takes your blood and starts diluting it to see how long they can still detect these antibodies. This first glass is very concentrated. Let's say this is a 1 to 40 titer. 1 drop of blue food coloring or ANA protein for every 40 drops of water or 40 drops of blood. Now we've diluted. The color is weaker. This is a 1 to 80 titer. We do it again and it's even more diluted. This is a 1 to 120 titer. The higher the second number, the more they had to dilute your blood to make the antibody disappear. That means the original signal was much stronger. And this is critical. A low titer like 1 to 40 has nearly a 1/3 chance of being a false positive, meaning it shows up in perfectly healthy people. But a higher titer like a 1 to 160 has only about a 5% chance of being a false positive. So the strength of the signal really matters. But what matters more? Number 3, symptoms matter more than numbers. This might be the most important point of the entire video. A positive ANA is not a diagnosis. It is one single piece of a much bigger puzzle. Studies show that when doctors order an ANA because a patient has clear symptoms like persistent joint pain or unexplained rashes, a positive result is much more likely to be significant. But if the test is ordered without that specific context, it is far more likely to be negative or falsely positive. This is why you are the most important person in this investigation. Your story, your symptoms, that's the context your doctor needs. Write down what you're feeling, when you feel it, and how it affects your life. This isn't just complaining, it's providing the crucial clues that help your doctor order the right test and connect the dots. Number 4, the pattern is a fingerprint. Digging a little deeper, the lab doesn't just tell us if the ANA is there, they tell us how it looks under a microscope. This is called the ANA pattern. Think of it like a fingerprint left at a crime scene. Different patterns can point towards different conditions. A homogeneous or smooth pattern that's often linked to lupus. A speckled pattern is more common and can be seen in many conditions like Sjögren's syndrome or scleroderma. And a nucleoidal pattern can also be seen with scleroderma. Again, these patterns aren't a final diagnosis, but they are powerful clues that help your doctor decide what to investigate next. Number 5, the surprise cause hiding in your medicine cabinet. Okay, we've arrived at number 5, the one I promised you would be surprising. You've got a positive ANA, you have some aches and pains, but what if the cause isn't a lifelong disease at all? What if I told you the cause could be sitting in your medicine cabinet right now? It's called drug-induced lupus. Certain common medications can cause you to develop lupus, resulting in a positive ANA. Possible culprit medications include blood pressure medications like hydralazine, antibiotics for acne like minocycline, and even common acid reflux medications like omeprazole. These medications cause a lupus-like syndrome with rashes, joint pain, and fevers, all while turning your ANA positive. And here's the incredible part. In most cases, when the offending medication is stopped, under your doctor's guidance of course, the symptoms and the positive ANA can completely disappear. It's a powerful reminder to always be mindful of the medications we take and to think outside the box. So let's bring it all together. If you were just told your ANA is positive, do not panic. It's not a diagnosis. It's a conversation starter. False positives are common, especially at low titers. But at the same time, don't dismiss your concerns. Communicate effectively with your doctor about exactly what you're experiencing. They may order some specific tests, or they may simply monitor. A specialist like a rheumatologist can be an incredible partner in figuring out if your symptoms are truly from an autoimmune disease or something else entirely. If you want to take an even deeper look into lupus or SLE, check out the video here. Have you dealt with a positive ANA? Drop a comment and share your experience. It just might help someone who's feeling confused and worried right now. I'm Dr. K from iMedicalSchool. Remember, keep learning and take charge of your health. See you next time.